Okay, so we've planned our case and we're ready to place our implants. This is the instrumentation that we will be using during the procedure, together with our guidance kit. Now, the operation of the kit will have already been explained to you. This is the start position of our patient, and you can see she's wearing a large upper bridge supported by the canines and premolars. The bridge is replacing the upper anterior, lateral and central incisor teeth, and you can see the abutments are clearly broken down. This patient has a very heavy occlusion. There's cracking and wear of the bridges in both the upper and lower arches. Now, on removing the bridge, we can see that the abutment teeth are plainly very broken down and the prognosis is poor. These teeth are carefully extracted in order to preserve the buccal and labial plates of cortical bone. The roots are checked to ensure all root fragments have been removed. Here we can see the planned positioning of our implants, and this template has been generated from the plan. The fit surface should be carefully checked but should not need any adjustment. The template should fit very accurately and stably in the patient's mouth. You can see here that the template is being supported by both the surgeon and the assistant, and the spoon is being used to guide the osteotomy preparation in the upper left lateral position. We're now moving across to the upper right lateral position, and these are going to be placed as delayed implants. Again, note the template is being very carefully supported. Now we move round to the upper right position in the premolar area, and this is to be an immediate implant. Again, this would be very difficult to do freehand using a drill, but with the guide, the drill is supported the whole time and prevented from moving around in the socket. It is now time to place our implants, and a site former is first positioned into the osteotomy site to confirm the position and integrity of the site. The implant is then carefully inserted into the osteotomy, following the same angle and position as dictated by the site former. In this procedure we are using tapered implants. Tapered implants are ideal for immediate placement, however they cannot always be fully guided as they are tapered rather than cylindrical. The surgeon is now checking and confirming primary stability of the implant before moving on to inserting the next fixture. Okay, we're now moving on to placing our second fixture in the position of the upper left lateral incisor. Again, the surgeon is very carefully looking at the angle and ensuring he is parallel to the site former before inserting the implant. Now, as this is a delayed placement, there will be a little bit more resistance because there is more bony support. The surgeon will insert the implant until he feels there is good engagement, at which point the mallet can be used to start helping to drive the implant fully home. This is done by gently tapping the knob on the top of the site former with our mallet. The patient should be first warned to expect a little bit of vibration and noise as the implant has been inserted. As you will notice in this system, the knob and the mallet are both made of PEEK to reduce the amount of noise that is produced during the process. Again, the surgeon is checking the primary rotation, and in this case the assistant is also turning the implant to see how well it is engaged in the osteotomy site, and you can see there is quite a bit of resistance to actually trying to turn the implant. Moving on to the next osteotomy site, and this is going to be placing in the delayed or the immediate socket where the implant is inserted into the socket, and again all our implants are now placed. You can see There is no sign of the implants in any way, they've all been buried, and these implants have been placed according to our original plan. The implant in the upper left fore position is level with the interseptal bone and has been nicely positioned to the correct depth. In the situations where delayed implants have been inserted, you can see here the two lines on the driver. This is showing the implant needs to be inserted deeper, and now the lines have been positioned just under the gingiva, showing it's at the correct depth. We're now ready to insert our denture. You will notice the denture has no labial flange. This is most important in order to protect the labial plate. Also, there is full palatal coverage in order again to not load the implants. I hope you've enjoyed this short presentation.